welcome to the deep dive.
Yeah.
Today, we're going to Thailand.
Thailand.
Yeah, to a meeting of the Chiangmai Computer User Group.
Cool.
And we'll be listening to their conversation about technology and health.
Sounds interesting, like we're eavesdropping on a brainstorming session.
Yeah, exactly. And they have some really thought-provoking ideas.
So what's unique about this deep dive? Well, these aren't experts.
Right.
It's just everyday people talking about how technology is changing healthcare.
Yeah.
And you know what? Their unfiltered thoughts, they actually reveal a lot about people's hopes and concerns about these advancements.
They're not just theorizing either.
Right.
You're sharing stories, debating potential questions for a talk on the subject.
Oh, wow.
It's like we're reverse engineering their insights to see what really matters to people when it comes to technology and well-being.
I like that, reverse engineering their insights.
Yeah.
Now, the Chiangmai Computer User Group, they usually meet to talk about computers and gadgets, but they've recently started including tech's impact on health. Interesting.
And you can really hear their informal, friendly atmosphere.
Oh, yeah.
They even figure out how to split the T-bill.
That's awesome. I love that.
Yeah, it's great.
It's that casual setting that leads to some surprising revelations.
Like what?
Well, for example, one member right away brings up data privacy.
Interesting.
And they're worried about searching for medical information online.
Oh, yeah, I can see that.
It makes you wonder, who can you trust with your most sensitive information?
It's a really valid concern in today's world, I think.
Right.
Think about it. Let's say you're researching a specific condition.
Yeah.
Could that be used against you? Like, could they assume you have that condition? Could it affect your insurance premiums or even your job prospects?
Scary stuff.
Yeah, it is. And this really highlights our anxieties about online privacy and what could happen to our health data.
Especially because health is so personal.
Exactly.
And it's not just hypothetical either.
Right.
Remember that case in New Zealand where the government sold taxpayer data?
Yeah, I remember that. Stories like that really make you think twice about who you share your information with.
For sure. As more of our lives move online, data privacy is so important.
Yeah.
We need to be thinking about transparency and accountability and what control people have over their own information.
Absolutely.
But then the conversation shifts to something more positive. Telemedicine.
Okay.
And you can hear the excitement in their voices when they're talking about how telemedicine can give more people access to specialists.
Yeah, that's great.
And they're not just talking hypothetically, they share real-life examples.
Oh, wow.
One member talks about using telemedicine for neurology consultations.
Cool.
Saved him time and money.
Wow.
Another describes managing MRI scans and consultations with a specialist in Bangkok, all through telemedicine.
Oh, wow.
These stories really show how telemedicine can bridge geographical gaps and help people who might not have access otherwise.
It's like a modern version of that Australian flying doctor service.
Yeah.
Remember that. They've been connecting remote communities with healthcare providers for decades.
Yeah, that's a great comparison.
The need for remote healthcare has always been there, but now technology is finally catching up.
Yeah, it's incredible to see how something that used to be futuristic is now a reality for so many people.
I know.
And we're just getting started.
Right.
Imagine a world where you can talk to the world's leading specialists right from your home. That's the power of telemedicine.
Okay, but are you ready for an even more mind-blowing topic?
What is it?
AI and drug discovery.
Wow, okay, I'm ready.
So one member asks a question that we've all probably thought about. Can technology make cancer detection and treatment better?
Yeah, that's a big one.
Right.
For sure.
And while that question might not have a simple answer,
Right.
the group acknowledges that AI could revolutionize drug discovery.
Interesting.
They talk about AI speeding up the process, finding new treatments, and even using existing medications in new ways.
Like repurposing them.
Exactly.
I've heard of that.
They even bring up an example of a medication
Oh, yeah.
that was originally for cancer, but now it's used to treat eye conditions.
Wow.
It's like AI is uncovering these hidden connections and possibilities that we might miss.
Like having a superpower research assistant
Right.
working all the time to find solutions.
Totally. And they even talk about the specifics,
Okay.
like how AI can test molecules and even predict how proteins fold.
Okay, now that sounds a little complicated.
I know it can get complex,
Yeah.
but the main takeaway is that AI has the potential to drastically shorten the time it takes to bring new drugs to market.
That's huge.
And that could be a game changer for so many people waiting for new treatments.
Absolutely.
It's amazing.
It really is. It really makes you think about the possibilities, doesn't it?
Yeah.
But of course, with any new technology, there are ethical things to think about.
Oh, yeah, for sure.
In the Chiangmai computer user group, they talk about that too.
Okay.
One member mentions that AI can be used for good or bad,
Right.
especially in healthcare.
Yeah, that's a good point. It's a reminder that we need to be careful
Right.
and make sure these advancements are used responsibly.
Exactly.
But then the conversation shifts to something really interesting.
What's that?
They start talking about AI for companionship.
Oh, wow.
Like, imagine AI being there for people who are lonely or isolated.
Yeah.
One member shares a story that's actually kind of sad
Oh.
about wishing they had introduced an AI companion to their mother before she passed away.
Oh, wow.
It really shows how AI could be important for our emotional and social well-being, not just our physical health.
That's true.
It makes you think about all the ways AI could improve our lives.
Right.
Not just treating illnesses, but helping us feel more connected and supported.
Yeah.
Like, what if AI could help with loneliness?
That's a really interesting idea.
It is, but let's take a step back for a second.
Okay.
We've heard concerns about data privacy,
Right.
especially as our lives become more digital.
Yeah, those are valid concerns, for sure.
Like, who can see our health information? And how are they using it?
Exactly. Those are questions we need to keep asking as technology keeps changing.
Absolutely. Then we have the potential of telemedicine to connect people with specialists no matter where they live.
Right.
We heard some great examples of how telemedicine is already helping people save time and money and get better health care.
Yeah, it's amazing how technology can help people get the care they need.
And then there's AI and drug discovery.
Right.
We talked about how AI could speed up the process of developing new treatments and even find new uses for existing medications.
Like that cancer drug that's now used for eye conditions.
Yeah, exactly. What if AI could help us find cures for diseases we thought were incurable?
That would be incredible.
Or what if it could create personalized medicine based on your genes?
The possibilities are really exciting.
But we need to remember the ethical considerations, too.
Yeah, for sure.
Like the group mentioned, AI could be misused.
Right.
So we need to focus on responsible innovation.
Absolutely. We can't just get caught up in the excitement without thinking about the risks.
Exactly. And that's what I like about the Chiangmai computer user group.
What do you mean?
They're not just accepting these advancements.
Yeah.
They're questioning them, considering the implications, and having these thoughtful discussions.
I agree. It's great that they're being so careful and curious.
Yeah, they remind us that we all have a role in shaping the future of technology.
It's not just up to the scientists and engineers.
Right. It's up to all of us.
So what are your thoughts after this deep dive?
What stands out to you?
Maybe you've used telemedicine yourself, or maybe you're interested in AI companions?
Or maybe you're worried about data privacy, or excited about AI-driven drug discovery.
Whatever you're thinking, we want to hear from you.
Yeah, hit us up on social media, join the conversation. Let's talk about these ideas together.
Because the future of technology is something we all share, and we all have a part in it.
That we've talked about a lot in this deep dive.
Yeah, we have.
But there's one story that keeps coming back to me.
What is it?
It's the story of minoxidil.
Minoxidil.
You probably know it as Rogaine.
Oh yeah, the hair growth treatment.
Exactly. And it was originally developed to treat high blood pressure.
It's a classic example of drug repurposing.
Right. It shows how powerful it can be to think outside the box.
And it makes you wonder what other hidden possibilities are out there.
Yeah, like what if there are already medications that could be used for other things?
And what if AI could help us find those connections?
It's like having a computer program that never gets tired, constantly searching for new ways to use existing drugs.
Yeah, it's not just about finding new uses for old drugs. It's about understanding how they work together.
Right.
How they affect different people based on their genes, and how we can make treatments better. AI could really change how we personalize medicine.
Yeah, instead of just giving everyone the same treatment, we could tailor it to their specific needs.
Exactly. That could make treatments more effective with fewer side effects.
That would be amazing. But with all this excitement about AI, we have to remember to be careful, too.
Oh, definitely. We need to make sure these discoveries are safe.
Right.
And effective before we get too carried away.
We need rigorous testing, ethical guidelines, and careful regulation to protect people.
Right. And that's where the Chiangmai computer user group comes in.
What do you mean?
They might not be scientists or anything, but they understand that technology is a tool.
Yeah.
It's up to us to use it wisely.
That's a good point. They remind us that we all have a role to play in shaping the future of technology.
By asking the right questions, demanding transparency, and having these important discussions.
Yeah, exactly. We can help make sure these advancements are good for everyone.
It all comes back to that idea that great power comes with great responsibility. And AI in healthcare definitely has a lot of power.
Absolutely. So as we finish this deep dive, I want to leave you with this.
Okay.
What questions are you asking about technology in your life?
What are your hopes and concerns about the future of healthcare?
Your voice matters, and your questions can help shape the future.
A future where technology is used ethically, responsibly, and for the good of everyone. It's been an interesting conversation.
Definitely a big thanks to the Chiangmai Computer User Group for sharing their thoughts, and to all of you for listening and joining us on this journey.
Keep asking questions, keep learning, and keep diving deep.
And don't forget to connect with us on social media. We love to hear from you.